Angeline, thanks for that report. Meantime, Spectrum Health is one of the many hospitals prepping to distribute this vaccine once it arrives. Joining us live to talk more about what we can expect over the next few days is Dr. Russ Lampin, Division Chief of Infectious Disease at Spectrum Health. All right, good morning, Russ. Let's dive right into it. What are some of the challenges that face us here in West Michigan as we get ready to set for distribution of this vaccine?
Well, we're extremely excited to have the opportunity to start vaccinating this week. And so we've already been putting measures in place for the last few months to start to look at some of the different challenges that we're going to face with the vaccine. I think the biggest issues that we've dealt with is looking at how do we distribute the vaccine, and which order do we give it to different healthcare workers and individuals involved in the healthcare process. But initially, obviously, the vaccine is going to be going to individuals who are going to have significant exposure to patients with COVID. And so we're looking at intensive care unit staff, ER staff, as well as healthcare workers who are involved in the care of patients who have COVID outside of our ICUs. The other areas that will be receiving the vaccine early on are elderly people living in long-term care facilities. So yeah, this has been a significant effort that we've put a lot of work into. It's been a multidisciplinary team with pharmacy, supply chain, nursing staff, physicians, medical ethicists to look at how we roll this out. And so this week is really going to be the culmination of a lot of effort that's already gone into place.
Most definitely. Folks are wondering when they can get their hands on this vaccine. You made mention to the elderly as well as frontline workers, but how about the general populace? When can they expect to get vaccinated?
I suspect that, despite all the information that we're receiving and the excitement that's surrounding the vaccine, I suspect it may still be a couple months off before vaccine is widely available to the general public for people without any medical conditions. There's a phased rollout plan. And so initially, again, it's going to go to healthcare workers, and then it will be moving towards essential workers. So people that obviously are involved with activities that need to help the economy move forward, as well as individuals who are older than 65 and may have risk factors for complications of COVID. And then my hope would be that by March, April, that vaccine is widely available and that anybody in the general public will be able to get vaccinated.
So we're talking March and April. Herd immunity, when is that a possibility?
Well, I think, once the vaccine is widely available at that time, we should be able to reach herd immunity. Most experts feel that probably we need to get about a 70% immunity rate in our communities before we get there.
Yeah.
And so it's going to take a while, and we're going to have to see millions and millions of people receive this vaccine before we achieve herd immunity.
Most definitely. It's kind of felt like mission accomplished today as we get ready to receive this vaccine as it's being distributed all across the 50 states. But you're saying put your patients on standby because it's going to be a couple of weeks, couple of months until we actually see some progress when it comes to lowering the numbers. Is that what you're saying?
No, absolutely. And I think there's really some light at the end of the tunnel here, and it's feels like an early Christmas present for healthcare workers. And I think everybody in this country to say, hey, this pandemic is going to come to an end.
For sure.
But I think it's important to remember, we still have 270 patients admitted at Spectrum facilities with COVID right now, 40 or 50 in the ICU. Our 7-day average test positivity is still hovering around 15%. Okay. So we're still seeing a lot of disease and a lot of sick people in our hospitals with COVID. And I don't see that changing, anytime in the next weeks to months until we get widespread vaccination and some of these measures of social distancing and masking take hold. We've seen some improvement over the past few weeks. But we're still seeing a lot of COVID patients.
Dr. Lampin, any other misnomers or things you'd like to clarify when it comes to vaccinations for the general public to kind of get themselves ready, whether or not they should or should not be vaccinated, as that decision is still widely debatable?
Yeah, I mean, the speed at which this vaccine has been produced is nothing short of miraculous. And I think it really just goes to show that when scientists and industry and the government all get on the same page and you put such attention towards attacking a single pathogen or single disease, how quickly things can come into place. But I think the thing to remember is that there have been no shortcuts in the science, that the safety measures that this vaccine has gone through are the same as any other vaccine. We know that vaccines are extremely safe. This vaccine has been given to over 20,000 people in its phase 3 trials. and we're seeing approval for it globally. And so I don't have any concerns. We're not seeing any significant side effects reported in these phase 3 trials. And the effectiveness is amazing. I mean, I don't think anybody anticipated that we'd be looking at a vaccine that is, 95% effective. So we've got a real tool here that appears to be completely safe and highly effective in ending this pandemic and helping us get back to normal.
Now, this is kind of worst case scenario, and I don't mean to do this, but I do want to ask you, what would happen if this virus were to evolve?
We haven't seen that, and the COVID viruses, which obviously coronaviruses, or I'm sorry, the coronavirus family of which COVID belongs, tends not to have significant mutations. And what these vaccines all target is they target what's called a spike protein on the surface. And so we just haven't seen that develop. And looking at other similar types of viruses, we haven't seen much in the way of mutations. So I think we're hopeful that we're not going to see a significant change in the virus that would make the vaccine ineffective. And I think a lot of us sort of have the analogy of influenza vaccine, right, where we have to get a flu shot every year because flu is always changing. That's an apples to orange comparison. So the virus is different. It appears more stable than influenza, and it's not anticipated that we're going to have to see changes in the vaccine because of mutation.
That's wonderful.
Now, we may need to have revaccination because of immunity that starts to decrease. But mutation has not been a significant concern.
Yeah, what is the actual half-life of, is that the proper terminology for when you receive a vaccination? How long will that last and protect somebody who actually gets the shot?
This is a great question that we don't have an answer to at this point.
Okay.
And so, it's interesting. So those phase 3 trials that have gone through and been reviewed by the FDA, they've shown safety of the vaccine. But that's one of the things that we're continuing to monitor is we have patients and individuals enrolled in those studies that we're going to keep looking at how long are they immune.
Yeah, most definitely. Doctor, anything else you'd like to add, most important for our viewers here at Fox 17 Morning News?
No, I think for people out there, I think it's important for them to pay attention, get their flu shot now, and when the COVID vaccine is available, get it. Until we have widespread vaccination and COVID rates have significantly declined, people still need to remember to practice social distancing, keep masks on when they're in public, keep washing their hands, and stay home when they're sick.
If you're just joining us, we've been talking with Dr. Russ Lampin, Division Chief of Infectious Disease at Spectrum Health. Thank you so much for joining us, Doctor.
All right. Thank you. Have a great day.
All right. Coming up after the